My name is Pascal. I'm the founder and executive director of Health Emergency Initiative. I'm also an Ashoka Fellow. I was inspired 10 years ago to make a difference in the life of people by bridging the gaps. Aware that many Nigerians die because of avoidable medical situations that will be resolved with less than 20,000 naira or less. And I also lost my father, a medical condition that could have been treated successfully if there was access to basic health care. So that was a major inspiration for me. November 2015, about 3 weeks after we came together to set up a GI, and it was in Lagos State University Teaching Hospital. On that very occasion, there were 3 of us, Mrs. Okolo, myself, and Oki and Peters. I was still doing my 8 to 5. I created time to visit the hospital and realized that with the 30,000 naira, we assisted about 6 patients. And some of them were having bills or medical conditions that required just 3,000, like cross-matching of blood, or some instances. I remember a woman who had been in the facility for 2 days after she had been discharged, and her balance was 2,500. So that her 30,000 naira was a game changer for her and many others who met both in the pediatric ward and other wards in the facility. Yes, I remember in July 2019, that was one instance that I went out to cry. It was a family that had 4 children, 5 years, the oldest boy, then the 3 girls. We had 3 years, 4 years, 3 years, and 1 year. Their mom was a house help somewhere in Apaja. She went to work and left the children. They didn't have a house help, so they left the children. She left them with their father. And the father locked them in the room to get to the bus stop to buy some items. So this was around 6:30 p.m. And when he went out, it was getting dark. One of the children lighted a candle, placed it on the mattress, and they caught fire. The oldest of them ran into Testimony Julius, ran into the refrigerator. But he ended up having 50 degrees burn. The younger ones had 73, 68, 66 degree burns. This happened in Aja. That night, it happened on a Tuesday. They were taken to a hospital called Doreen Hospital. It was a private facility. They could not manage it. So they took them eventually to one of the teaching hospitals in the mainland. And when they got there, they asked them to make deposit to move them to ICU, that's intensive care unit, at 250,000 per month. They couldn't afford it, the parents. Within 24 hours, the family lost the 3 youngest daughters. So all of them died, 1, 2, 3, within 24 hours. The oldest, who had 50 degree burns, was still in that accident at the emergency ward, ASAT, between Tuesday till Friday when they alerted our organization. So when I was still doing my 8 to 5 at that time, so I mobilized our team. Saturday morning we stomped that place. And I got there and said, why is this only surviving child not receiving care in intensive care unit or in the pediatric ward? And they said, no money. I said, how much is required? They said 30,000. And I asked, nobody in Nigeria, no religious, even the teaching hospital, no room for a window of compassion for this child. They said nobody. So I went out to cry for a while. But it doesn't end with crying. So that's one incident that stands out among over 33,000 cases we've handled. I cried and we swung into action. The major challenge we have is funding. We have faced that hurdle. There are many instances, many hospitals and facilities have called us for help. We are unable to meet the number. We have presence in 14 states with over 80 hospitals being supported. So we are unable to meet 5% of that need. The other important challenge we face is visibility. People do not easily give to someone they don't know. So part of our pain point is ensuring that the work we do, as touching as it may be, will be in the face of people, especially corporate Nigeria and other philanthropists who love to give back to society. So these are the two major areas we have faced challenges in the last 10 years. It's a fulfillment for me because we see that someone who would have ended up dying here in Nigeria, there's very little attention given to lives of people. We recognize that the work we have done so far has made us to be next of kin to persons who would have given up hope. We see women saying that I have given up. I was waiting that my child might die any time from now, until the social worker, until the hospital official said, there's one organization, HEI. So we fit into that next of kin support for indigent patients. But beyond indigent patients, accidents happen to both the poor and the rich. There have been very prominent people who were exposed to accidents that also at that point they were unconscious. We came in as a next of kin, as a beacon of hope. And that's why we go to all the facilities we are supported. We have large volume of appreciation letters and plaques expressing gratitude of the support we have brought to people in the facilities. And that earned us an award. Lagos State Government in 2020 gave us an award as the best supporting NGO. Federal Road Safety Corps in 2022 gave us an award as the best supporting NGO. Across Lagos and other cities in Nigeria, this has been pouring in because of our transparent and credible way of supporting vulnerable and indigent people. I recognize that one life saved is better than billions wasted. When I see someone's situation turns better because of the little help the organization renders or I render, I feel fulfilled that I've made a difference in someone's life. I think that's a fundamental part of why I'm involved in this. So we, as an organization, we have this corporate governance system that you can reach us via our social media handles. You can reach us through info@hei.org.ng. You can call 08037228843. But more importantly, you can also request for a meeting and have a more detailed engagement with our team.
If I had the superpower to save more lives, I would be that person who appeared in different locations to save lives, even if I'm not there physically, but they are able to access basic healthcare. That is my dream, and that is what I desire to happen in 5 years' time. I love this.